Headache, fever, or sore muscles. Chances are you've reached for ibuprofen at some point. But have you ever wondered what that tiny pill is actually doing inside your body? How does it relieve pain, and what risks come with it? In this video, we'll explore ibuprofen in detail, its history, how it works, its uses, side effects, and how to take it safely. By the end, you'll understand ibuprofen like never before. Ibuprofen was first developed in the early 1960s by a team of scientists working for Boots, a pharmacy company in the United Kingdom. At the time, doctors needed a safer alternative to aspirin, which often caused serious stomach irritation and bleeding. After years of research, they created ibuprofen, short for isobutylphenyl propionic acid. Initially, it was prescription only and used mainly for rheumatoid arthritis. But by the 1980s, it became available over the counter, quickly earning a spot in medicine cabinets around the world. Today, it's one of the most commonly used painkillers worldwide. Ibuprofen belongs to a class of drugs called NSAIDs, non-steroidal anti-inflammatory drugs. Other common NSAIDs include aspirin and naproxen. What makes NSAIDs different from something like acetaminophen or Tylenol is that they don't just reduce pain and fever, they also fight inflammation. That's why ibuprofen is often the go-to choice for things like arthritis, injuries, and muscle pain. So how does ibuprofen actually work? In your body, pain and inflammation are triggered by chemical messengers called prostaglandins. Prostaglandins are made by enzymes called cyclooxygenases, or COX enzymes for short. There are two main types, COX-1 and COX-2. COX-2 makes prostaglandins that increase pain, fever, and swelling. COX-1, on the other hand, helps protect your stomach lining and supports kidney function. Ibuprofen blocks both COX-1 and COX-2. By doing this, it reduces prostaglandins overall, which means less pain, less swelling, and lower fever. A simple way to think about it. Prostaglandins are like the body's alarm system for pain and inflammation. Ibuprofen doesn't fix the root problem, but it turns down the volume of that alarm, making you feel better. Because of this, ibuprofen is widely used for headaches and migraines, toothaches, muscle aches and back pain, menstrual cramps, arthritis and joint pain. Fevers from infections, in some cases, doctors even recommend alternating ibuprofen with acetaminophen for stubborn fevers, especially in children, though this should always be done carefully and with medical guidance. Like all medicines, ibuprofen comes with risks. The most common side effect is stomach irritation. That's because blocking COX-1 reduces protective prostaglandins in the stomach, making it more vulnerable to acid. This can lead to nausea, heartburn, and in some cases, ulcers or bleeding. Long-term or high-dose use can also affect the kidneys, since prostaglandins help regulate blood flow to them. People with kidney disease should be especially cautious. There's also a cardiovascular risk. Frequent use of NSAIDs has been linked to a higher chance of heart attack and stroke, especially at high doses. So while ibuprofen is safe for most people when used correctly, it's important not to overuse it, and to take it with food to minimize stomach upset. The usual over-the-counter dose for adults is 200 to 400 milligrams every 4 to 6 hours as needed. The maximum daily dose without a doctor's supervision is 200 milligrams. Under medical guidance, the prescription maximum can go up to 200 milligrams per day. For children, the dose depends on body weight, and liquid forms are usually used. Always follow pediatric dosing instructions carefully. A key safety rule: never mix ibuprofen with alcohol and avoid taking it on an empty stomach. And if you need it for more than a few days in a row, it's best to talk to your doctor. How does ibuprofen compare to other pain relievers? Acetaminophen is better for fever and general pain, but it doesn't reduce inflammation. It's also gentler on the stomach, but harder on the liver. Aspirin is an older NSAID and also works against inflammation, but it causes more stomach problems. Today, aspirin is mainly used at low doses to prevent heart attacks and strokes. Naproxen is another NSAID, similar to ibuprofen, but it lasts longer, meaning fewer doses per day. So the best choice really depends on the situation and your health profile. Ibuprofen isn't for everyone. You should avoid it if you have stomach ulcers or bleeding disorders, have kidney disease or severe liver problems, have certain heart conditions, are in the later stages of pregnancy. In these cases, doctors usually recommend alternatives. To sum up, ibuprofen is a powerful, widely trusted pain reliever. It works by reducing prostaglandins, the chemicals that cause pain, fever, and inflammation. When used properly, it's safe and effective. But like all drugs, it has risks, especially with overuse. The key is balance. Use it wisely, don't exceed the recommended dose, and when in doubt, consult a healthcare professional. If you enjoyed this video, check out my breakdown on acetaminophen for a deeper comparison. And don't forget to subscribe for more simple explanations of the medicines we use every day.